An average of 3,500 babies are born in Uganda every year. This means tens of thousands of women become mothers each year. And for Merus Mutiaba, who for most of her entire lifetime has helped mothers deliver and lead healthy lives, Mother's Day comes to recognize their role in society.
Because of what the mother goes through from the time she conceives up to the time the children are they have grown big and they are responsible people. A mother is like a nurse, a health worker, is like a teacher.
Sadly, in Uganda, at least 16 mothers die as they try to bring life on earth. According to the Uganda Demographic Health Survey and other documented data from reputable organizations like UNICEF, an average of 336 maternal deaths per 100,000 live births occur every year. Charles Owekmeno, the National Program Coordinator at Sexual Reproductive Health Uganda, says this day should be used to make a change towards the harrowing statistics for better.
What is affecting our mothers today and even their productivity is mainly sexual reproductive health related issues of maternal health services. We're still having so many of our mothers dying because of avoidable maternal health challenges. We also still have so many mothers who are delivering out of hospital.
Owekmeno says mothers lack the capacity to deliver proper sexual reproductive health education to their daughters especially.
And that's why you're seeing most of their daughters becoming teen mothers, and yet they even don't have capacity to bring up their children very well. And we're having a generational challenges of mothers who cannot bring up their children up to the standard that they would have wished.
We need a quality population. On the streets, go to Kampala. Borders just want to eat themselves. Taxis want to eat themselves. The number of people. We literally have no. It is hectic. People are stressed.
25 of every 100 mothers in Uganda are teens. This rate of teenage pregnancy is worrying, though it may seem low compared to 28% in sub-Saharan countries and West and Central Africa. Young mothers in Uganda risk poor maternal and child health, being isolated, attempting unsafe abortions, failure to continue with school, and poverty. This is why Chekweko wants government to roll out a national family planning scheme.
No country has ever developed without a strong family planning program. Talk about China, Japan, America, where? Even just Botswana here, which is one of the richest in Africa, they produce 2 children. So Uganda cannot think that we shall propel ourselves from the low income. The president has been struggling moving this country to middle income, but he has not been successful because every time they add more resources, it is taken away by the rapid population growth rate.
He says the energy of healthy women who have access to family planning, obstetric care, the prevention and management of STDs, safe abortions, and infertility treatment will make the goal of sustainable development more attainable.
But we want to see this reflected in the budgets of the local governments.
Prioritize those key issues that make mothers feel comfortable and take full charge of their health so that they're able to bring the quality of the generation that we need as a country.
The framework is existing, but what we just need to intensify is the education of our masses. When we have a society that is more or less not educated, it is a hard task to convince them and to make them understand why at this time we need to really embrace family planning and ensure that they avoid all these complications our mothers are getting.
However, there are other societal behaviors that have made it difficult for mothers to live in accommodative environments.
A lot of violence against the mothers. We still have common cases of wife beating. We still have common cases of mothers being denied ownership of properties, and some of them are single mothers.
Deputy Police Spokesperson Paul Namaye says there are a lot of avenues within the law that oppressed women and mothers can use to seek justice.
The Constitution and all the other laws relating to the Constitution actually protect Ugandans within Uganda. And there are also some specific laws. For example, when we look at the Domestic Violence Act, we look at the Torture Act, we look at the Penal Code Act. These laws have provisions within which the women's rights of mothers are exercised, and any abuse of these rights definitely carries with it a penalty, which can be seen.
Some studies that have been published by the National Library of Medicine in the USA state that fertility regulation is a preventive health measure and a way of achieving gender equality. Walter Mwesije, NTV.